Hey everyone. So, to be able to perform an OT evaluation on someone with a spinal cord injury, you definitely need to be able to identify dermatomes and sensory impairments, have a clear understanding of the ASIA scale and how that relates to their function, what they'll be able to do and won't be able to do, be able to assess manual muscle strength, range of motion, have a clear picture of the client's home environment and also their support system. Understand types of wheelchairs and resources to obtain an appropriate wheelchair and any type of durable medical equipment. I also think it is important to assess their overall mental health and to recognize if the patient is showing signs of depression, because that's something that is really common if someone's had a spinal cord injury. And then be able to provide the client or caregiver with resources to help with those psychosocial needs. So most of you know that I started working straight out of OT school with the pediatric population. So I have no experience with spinal cord injuries regarding that population. I currently work in outpatient rehab, and I've been there for about 3 years and can say that I've seen maybe 2 patients with spinal cord injuries, and we didn't see them for a very long time, so I do not have a lot of experience. I can recall one of the gentlemen that I treated was a complete spinal cord injury, cervical level, I think C6, C7. He already had a wheelchair. He was pretty far out, just kind of needed some fine tuning. So we were working on a lot of proximal upper body strengthening, fine motor coordination, and then just looking at his ability, overall to do self-care tasks, dressing and feeding and things like that. And then I do remember working with a gentleman who was a partial spinal cord injury. He ambulated with a single point cane and he did live alone. So we were also working on upper body strength, scapular stabilization, fine motor coordination, but also standing balance and functional tasks in standing. So I understand the treatment of spinal cord injury on a very general level, of providing education on positioning, pressure relief, home modifications, caregiver training, and joint protection. I understand types of adaptive equipment and durable medical equipment to recommend for the client, and I feel pretty confident in assessing manual muscle strength and range of motion. So what do I need to develop? Like I said, spinal cord injury requires an in-depth understanding of spinal segments and nerve integration, as well as understanding comorbidities that are secondary to the spinal cord injury. So since I have very little experience, I would want to increase my comfort with the ASIA scale and understanding the impact of comorbidities such as depression, arthritis, diabetes, obesity, lymphedema, hypertension, and autonomic dysreflexia, which were some of the comorbidities described by Tate et al. 2015. I need to increase my understanding of assessing muscle tone using the modified Ashworth and increase my clinical reasoning skills regarding the use of assistive technology. I would like to be more competent in wheelchair recommendations and modifications, since that's something that I really don't have to deal with too much right now. So what practice skills do I need to develop? Well, I'm familiar with splint modifications because I do have to fabricate splints in the outpatient setting. So I feel fairly comfortable with that. Splinting, joint handling, positioning needs, and would feel comfortable making orthotic recommendations to prevent joint deformity and increase function. Something I understand more generally is bowel and bladder management. So I would like to know more regarding catheter management and bowel programs, and would like to increase my comfort level with various transfer techniques and what transfer techniques would be most appropriate for that specific patient. So resources, I found this wonderful resource by the NSW Agency for Clinical Innovation. It was written by Ford, K. and Skipper, 2014, and it was an overview of OT interventions for adults with spinal cord injury. I've already saved it as a PDF on my computer because it is a great resource. So I think it's around 36 pages, and it's broken into sections, and some of the sections, it provides very, very quick and easy accessibility for information on orthotics, adaptive equipment, lifting and transfer equipment, mobility equipment, assistive technology, home modifications, work, leisure, and also driving. Each section includes a relevant evidence-based journal article that's attached at the end. So you could, click on that if you needed more information. And then they also have online resources for the clinician and for the patient. Each section is pretty fairly easy to read. So if you needed to if you weren't sure about something, you needed to reference it really quick, you could pull it up, go to the table of contents and get to exactly what you were looking for in a pretty quick manner. So I think that's something good to kind of have on standby. And some of the articles that I felt would be most beneficial for me was the State Spinal Cord Injury Service, the abilityhouse.org, and the Home Modification Information Clearinghouse. Also, I found a continuing education course from Rehab Edge. They offer a detailed spinal cord seminar. It's 2 days, so it's all day Saturday, all day Sunday, and it covers a range of spinal cord interventions, including orthotics. It's for both PT and OT, but only the OTs have to complete the orthotic part of the course. It is kind of expensive, it's $500, but it does give you 12 continuing ed units. So if I was working with spinal cord patients pretty frequently, or ended up in the future, that's something I would probably want to take advantage of. And then when I completed our most recent spinal cord case study, I found that YouTube was very beneficial. So it helps me to actually be able to see it, because it's one thing to read it and try to understand it, but when I can actually see someone with a specific level of spinal cord injury performing transfers and different functional tasks, it just makes more sense to me. So I think YouTube is also a great resource. And that's my professional reflection. Thank you.